There is no one-size-fits-all approach to vaccination acceptance, demand, delivery, or decision-making. Building trust in vaccines requires an understanding of the unique social, cultural, political, and economic factors that influence a person's decisions or their ability to become vaccinated. The Sabin Vaccine Institute is a nonprofit organization that leads advocacy for expanding vaccine access and uptake globally and advancing vaccine research and development, amplifying vaccine knowledge and innovation. Sabin and its Vaccine Acceptance and Demand Initiative is committed to advancing vaccines and vaccination through understanding the social and behavioral drivers of vaccination success. The initiative awards social and behavioral research grants to interdisciplinary research teams in low and middle-income countries. These teams explore the local barriers and enablers of vaccination acceptance, demand, delivery, and decision-making. They design and pilot and evaluate strategies that are informed by and responsive to the local community context and that community's needs. Through this initiative, we hope to contribute to the related evidence base in underrepresented communities and regions and to translate that research into evidence-informed recommendations. Through showcasing how these research teams design and implement community-based research and interventions, we hope that other researchers and implementers can draw out lessons and insights to incorporate into their own work and yield effective evidence-based solutions in similar settings.
In Guatemala, researchers at Universidad del Valle de Guatemala used a community-based approach building a transdisciplinary research team by training local community researchers in order to estimate the prevalence of COVID-19 vaccination hesitancy and understand its determinant factors among indigenous communities in Lake Atitlán, Guatemala.
Un equipo transdisciplinario de la Universidad del Valle de Guatemala investigó las razones de rechazo a la vacuna de COVID-19 entre junio y agosto del 2022. Sololá, que es una región donde la tasa de vacunación es menor al 25%, donde está el municipio que tiene la tasa de vacunación más baja de todo el país, que es menor al 10%, y que tiene una alta diversidad histórica, lingüística y étnica, que también lo hace un lugar bastante complejo.
In north-central Nigeria, researchers at Women Advocates for Vaccine Access and Direct Consulting and Logistics Nigeria collaborated to investigate the socio-behavioral drivers and determinants of COVID-19 vaccination in the Federal Capital Territory of Nigeria. Drawing on the World Health Organization's Behavioral and Social Drivers of Vaccination, or BESDA, framework, the team first assessed the socio-behavioral determinants and drivers of COVID-19 vaccine uptake among healthcare workers and eligible adults. Then, using those insights, the team co-designed and co-disseminated targeted messages using a human-centered design approach.
The vaccine issue we're trying to address is vaccine hesitancy among eligible adults and healthcare workers in Guatemala Federal Capital Territory, North Central Nigeria. So vaccine hesitancy in this case is, delay or refusal to take the vaccine despite the availability of immunization services, COVID vaccine services in the community. We used human-centered design to co-design and co-disseminate, targeted messages, with trusted messengers to increase vaccine uptake among this hesitant group.
Researchers at the University of Liberia conducted a mixed methods study to investigate the socio-demographic and health characteristics of individuals who opted for a first dose of any COVID-19 vaccine in Liberia, and to investigate the association between receipt of first dose and intention to receive both a second and booster dose, as well as explore if personal experiences during the 2014 Ebola epidemic impacted COVID-19 vaccine decision-making.
Vaccination acceptance research is very important. There are a lot of emerging infectious disease that currently has no cure. And the only fight to these different infectious diseases is to obtain a vaccine. So if we are able to research on what are people's behavior, what drives people to go for vaccine, reducing the hesitancy and increasing the vaccine acceptance level, the general public will be highly safe from this.
Waterloo, Sierra Leone. Researchers at Loma Linda University, in partnership with the Christian Health Association of Sierra Leone and the Waterloo District Health Medical Team, are implementing a mixed methods study to understand perceptions and acceptance of the COVID-19 vaccine amongst healthcare workers in Sierra Leone. Findings will be used to develop a strategy that supports vaccine acceptance among healthcare workers and shared with stakeholders in order to increase vaccine uptake with the general public.
What the Sabin funding allowed us to do is to mobilize some of the work that we've been doing and target it in a very exciting area, which is kind of vaccine acceptance and hesitancy, particularly in the face of COVID-19. So as a result of the funding, we were able to actually put to test this task shifting strategy that we've been using in schools and in hospitals, and to see whether or not we can also translate that into actually engaging the larger channel health network to support providers and other healthcare workers to increase vaccine uptake in the community.
In the Indian states of Uttar Pradesh and Bihar, researchers from the Center for Social and Behavior Change at Ashoka University implemented a large-scale, quasi-representative in-person survey in a rural setting to empirically estimate demand for the COVID-19 vaccine, the determinants and barriers of this demand, and challenges regarding vaccine supply. The Asian Development Research Institute, a nonprofit civil society organization dedicated to social science research, and Immunize, an initiative working to create scalable health communication and behavior change systems, have teamed up to implement a study in the Indian states of Bihar and Jharkhand. The objective? Partner with community-based organizations to design trusted and effective COVID-19 vaccine-related timed messages to the public, local authorities, cultural leaders, and influencers.
We want to thank Sabin for the opportunity to conduct research in this field. So far we have been able to identify groups in our research areas that have been primarily known to be sort of lower in the area of vaccine acceptance, and also identify certain factors that lead to vaccine hesitancy. We are also in the process of recognizing social media as a barrier as well as a driver for change in increasing vaccine uptake in the communities that we are working in.
In Bhopal, India, researchers at Sankath, a nonprofit working to improve health across the lifespan through empowering local communities, used community-based participatory methods such as photo voice and community workshops to explore how COVID-19 vaccine access and uptake is shaped by historic and entrenched structural inequities that affect transgender and disability communities. Their findings will be used to develop a vaccine equity action plan to disseminate to local policymakers.
When it comes to vaccine acceptance, a lot of the conversation is dominated by vaccine hesitancy, often placing the blame on individuals and communities who are not coming forward to take the vaccines.
We started the Vaccine Equity Project, which looked at the experiences that trans and non-binary folks and persons with disabilities are facing while accessing not just vaccination, but also information related to vaccination. We wanted to look at the situation from the community lens, from the lens of the people who are at the center of it.
In Thailand, researchers at Adams Love Global Foundation for Men Who Have Sex with Men and Transgender Health seek to understand vaccination decision-making behaviors, including physiosocial aspects of COVID-19 vaccine acceptance among marginalized and at-risk people living with HIV, including men who have sex with men and transgender women, in order to explore solutions to vaccine service access and delivery in this population.
The COVID-19 epidemic has exposed immense inequalities and vaccine inequities in our world, and vulnerable populations, especially people living with HIV, have been impacted by psychological stress, health-related, and socioeconomic burden. So there is a lack of literature and studies on COVID-19 vaccine acceptance and demand in this particular population. So we are very excited to conduct this study and explore the vaccine-seeking needs of of people living with HIV, as well as portray their recommendations for future vaccine implementation.
You might be wondering, what approaches do these researchers employ to achieve their project aims and objectives? Robust social science research is time-intensive and relies heavily on building trust with the community under study, including vulnerable and historically marginalized populations. In Episode 2, learn how each research team worked with and within these priority populations to gather rich and nuanced evidence-based knowledge and co-design interventions to meet the needs of the people.